name is Dr Senthil Kirubakaran. I'm a consultant cardiologist and electrophysiologist at the Portsmouth University Hospitals NHS Trust. When I decided to become a doctor, I have to be honest, I come from a family of many doctors, and as a consequence was exposed to this area from very earlier on as a childhood. But I particularly like the idea of helping patients, and particularly seeing patients who are not very well and helping them and trying to treat them. And cardiology was an area that I was always very interested in. I was fascinated by the heart, by how it works, and even in medical school, this was the area that fascinated me the most. It's the organ that's obviously one of the most important organs in the body. And if this goes wrong, then clearly you need to do something about it. But it's a fascinating organ of the body. And I would say cardiology also gives the opportunity to treat these problems with the heart and can make big impacts and improvements to patients' quality of life and life expectancy. The most rewarding part of my job is seeing a patient in clinic who's clearly very troubled by their cardiac condition, talking to them about options of how to treat it, and then obviously treating it, and then seeing them later on and seeing what impact the changes you have made to their quality of life. And cardiology really offers that opportunity to make very big impacts to a patient's quality of life. And what I love about my job is that I see them right from the start. So I see them in the clinic, I see them during their treatment journey. If I have to perform operations or procedures on them, then I do the procedures myself in the majority of cases. And then I see them in my clinic afterwards. And I would still say one of the most rewarding aspects of my job is having that patient coming in, shaking my hand as if to say, thank you so much, you've given me my life back. And I thank you for all you've done. And I still keep cards and letters that patients have given me, and I keep them in my drawer in my office. And I would say I sometimes look at my drawer and think, this is why I do my job. It's a fascinating job and plenty of opportunities to help patients.